Well, good afternoon, Rochelle. Thank you very much for spending your time with me today. I wonder if you could introduce yourself and tell us a little bit about your school.
Okay. My name is Dr. Rochelle Bates. I'm Families in Transition Coordinator at Confluence Academies in St. Louis, Missouri. We have about 2,800 students. We are pre-K through 12th grade, and we also have a performing arts school also.
Great. So with the return to school in the COVID-19 environment, what are the top 1 to 2 challenges you're dealing with right now?
Okay, one of the things is just working with our parents. I'm specifically talking about our families in transition families. Really housing, permanent housing for them. I've been working with the COC, which is the Continuum of Care, because we're looking at some of the tools that we use that qualifies our families for at-risk housing and what that tool looks like to make sure that it's racially equitable so that our families will be able to get an appropriate score so that they can get housing. So that's one of the things, committees that I'm working with them to do that. And the other, I guess, challenge that I see is just our families having adequate space in order to do remote learning. And because most of our families, because they're in transition, their academics are already at risk. So one of the things that we're looking at, how can we adequately ensure that our families in transition get the best possible education, and what resources and things do they need in order for us to achieve that as a network?
So let me go back to what you said about the continuum of care, because that's really interesting. When you're talking about that tool, that's that vulnerability survey tool that kind of determines who gets priority for services, right? And I know it's been shown that there is absolutely a problem with racial equity there, and with white families often getting put up higher on the list than Black families and other families of color. So I wonder if you could just tell us a little bit about the process you're going through with the COC to try to address that. And I hope that when the tool's ready, you might consider sharing with us so we can get it out to other communities as well.
Okay. Well, what we do with that, because we established, the COC established a racial equity committee. And one of the responsibilities of that committee was to look at the tool, to make a determination if the tool that we're using is adequate for our families. So the subcommittee that we have, as a matter of fact, we met yesterday and last week. We meet every other week. The subcommittee does. So we began to look at all of the questions on the assessment tool to make some determinations on how the questions is asked, what was the meaning of the question, and do we have the ability to change the question if we think the question is not getting to the people that it needs to get to. So we've done that work. We went through all of it, and we made some recommendations to the other committee that's actually looking at the wording of the VDAT to make sure that we can change the wording. And so we met, the Racial Equity Committee met on yesterday. Okay. And what we decided, we have submitted information to that committee, with the Racial Equity Committee, a member is on that committee also, so that we can have crossback between the wording and what we see. So we're just in the beginning stages of it, and looking at the wording and being able to make some changes, and talking with our COC chairperson to ensure that when we make those, could we make those changes, and if we can make them, how quickly can it be made for us to use that tool.
That is such important work. And I remember when we talked the first time last year, I think, and you said that you had been on your Continuum of Care and been really active for a while. So I'm so glad that you're able to be part of that with the view that you have of families serving homelessness from your position in the schools. So thank you for giving me a little bit more information on that. And now I just wanted to ask you about some of the other strategies that you're putting in place to help meet the needs of your families and students experiencing homelessness, or in transition, as you say, which is a better way to say it.
Okay. One of the things that we're doing, because we did a survey, the majority of our families said that they would like to have virtual learning or remote learning. But we had 175 parents that said that they would like to have their students in school. So one of the things that we did was look, our 3 elementary schools are now what we call virtual learning sites. So parents can bring their children to one of our virtual learning sites where we would have student support as well as a teacher there. They'll still be on virtual learning, but they'll be able to get hands-on instruction from teachers if they're not understanding what it is. It's a full day. So we'll still provide breakfast, we'll still provide lunch, we'll still have those services that they would have had in school, we'll also have in virtual learning. Because one of the things that we looked at, we already know that our families in transition are at-risk families before COVID-19. So this ups their risk of getting the best possible education that they have. So we had to begin to look at those barriers to say what would stop us. So we're still providing bus transportation for the ones that need transportation. We're also providing cab service through McKinney-Vento for those families that need to get their student to any one of our sites.
That's fantastic. And now a lot of people have told me that they're having some challenges with the bus and the cab transportation because of some of the hygiene requirements and the distancing requirements. So is that something that you're having to deal with? Are you doing social distancing on buses, and are the cabs, I don't know, disinfecting between riders, or how are you dealing with that?
Yeah, well, we talked about that because our riders, we pick them up in the morning, and then the only time they get back in the cab is in the afternoon. I worked with both of our providers prior to and worked out a plan with them for disinfecting and saying these are the guidelines that we have at the school. And I didn't make, we call it community-based organizations. They're under the same guidelines with the health department as we are. So we didn't try to make anything different because we wouldn't be able to monitor it. So I sent out a list of things that we were doing that they had to put in place. So I worked with them really from June until now to assist them in making sure that they have those things in place and how they was going to disinfect their cabs so that we can do that. With the bus, it's a little bit differently because with the virtual learning, we're not going to have a whole lot of students on the bus already, but we've worked out with First Student how those buses would be disinfected.
That's fantastic. I love to hear you say I've been working on it since June, because it seems like, in some places people are scrambling now to try to put things together, but you've obviously been working on this and kind of had your plan in place for a while.
Thank you so much.
Okay, thank you, Rochelle. Have a good day.
Okay, bye-bye.